A very warm welcome to the program. I'm Felicity Ezewike. Over the weekend, 2 suicide attempts was prevented by the Nigerian police on the Third Mainland Bridge. We know this only because it was reported. In Africa, sadly, suicide claims the lives of over 34,000 people every year, with many more attempting to take their own lives. Globally, it is the third leading cause of death among young people aged 15 to 29. World Suicide Prevention Day, marked on September 10, aims to raise awareness about the importance of transforming the way suicide is perceived. Changing the narrative on suicide is a thematic drive for this year, but are we really making real headway in changing the narrative? That is our focus today, to discuss where Africa is at on suicide prevention and how we can improve our responses. Our guest is a mental health campaigner and founder, We Hold a Hand, Kelvin Voen. Thank you very much for speaking with us and welcome to Onslaught.
Thank you very much. Thanks for having me.
What is the latest data? What does it tell us about Africa's effort working to prevent suicide?
Yeah, I'm not sure of the data, but I'm aware of the awareness is improved. There's still a lot to do in terms of getting people to understand mental health and just the stigma and misconception around seeking help. But from what I'm seeing, we're progressing, but it's very slow. It's still,
okay.
We have a lot to go.
We understand it's a global problem, but the WHO data does state that 73% of global suicides occur in low and middle income countries, and these are mostly in Africa. Besides mental health problems accounting for 11% of the risk factors globally, what can you tell us about the key contributing factors here in Africa?
Yeah, I would say in Africa, from my knowledge, it's financial reasons. Again, financial crisis can cause a lot of people go into depression. And if they don't have that education to seek help early, I think that's where they can lead to, taking their lives. So that's what we do. We talk about early intervention because for me, people don't just wake up in the morning and feel that way. It's kind of a gradual progression towards that crisis. And when they are in that like level 10 crisis, I would say, that's when they can either harm themselves or harm other people.
Yeah, I would like to press you more on that, but I want us to maximize the time we have. So I'll just move forward and ask you about young people. That's the demographic that's worrying a lot of people. Are there specific risk factors associated with suicide in African youths compared to other age groups?
Yeah, I would say, again, with social media these days, there's so many factors that can lead people into severe depression. And it could be just the pressure from, life and wanting to be successful, to various mental health challenges like depression, anxiety, or even addiction, social media, gambling, drugs. So those are, I would say the major risks that a lot of young people are facing.
Yeah, okay. I want you to speak more extensively on social media and its influence on young people and how this might degenerate to the level where the young ones want to take their own lives. People show only the good sides most of the time. They show the picture perfect life that they have. Is there something that's being done to draw on and let young people know that all that glitters is not gold and your life is as good as it possibly can be at the moment where you are at?
Yeah, I think again that's why education is really important for a lot of young people to understand that social media is a virtual world. Like a lot of the things they see online are not real, and they shouldn't compare their lives to other people because I think these days with social media, people seeing their friends on holiday or having a good time, and they cannot afford a lot of these things, then that can get them to start thinking their life is not good or there's something wrong with them, or people just showing, as I said, the highlights of their life. So yeah, I think young people need to understand that it's not everything they see on social media is real, and they should learn to just appreciate themselves and seek help if they start feeling any kind of way, because it's all about that early intervention. Once you start feeling that way, or sometimes I would even advise to delete the app or unfollow certain pages that you know is making you to feel upset or any negative feeling from
I think
being
you
on.
guys really do have your work cut out for you. I mean, when you think about social media, you you think about how you can divorce yourself in this day and age. It's almost like everything is intertwined. So it has to
Yeah.
take more than words, really, to get actions from young people. But there are those
Yeah.
experts that suggest that suicide is preventable
Mhm.
on the one hand. And then there are skeptics who say experience tells us otherwise, that detection is often impossible because the side cases of famous or seemingly happy folks who had died
Yeah.
by suicide. How would you,
Yeah.
as somebody who has been dealing with, campaigning for better mental health, how would you respond to this argument and how
Yeah.
can we improve detection?
Yeah, I think it's definitely preventable, and it's not just to the people who are feeling this way, but to people around them. So I think that's why education for everyone is really important to be able to spot signs when people are feeling withdrawn from their friends or their family or even work, or they're not just their usual self. Because again, this thing don't just happen one day. It's different level, and the more they're getting to that really severe stage, that's when, yeah, this can happen. As I always tell people that work with me, is that no mother gave birth to a child that is going to commit suicide. Something happened, and we need to find out what's the cause and try and prevent that cause of why people would get to that level. I don't think there was anybody in their younger years would ever think they would find themselves in that position. But it does happen because it can happen to anybody if they don't have that early intervention.
I'm curious, Kelvin. It seems almost like a taboo subject in some areas. How do you broach the subject of suicide when you maybe, what do you say really when somebody is, talking about such tendencies? How do you have a conversation?
Yeah, I think it's sometimes again, you just give them that space to express themselves and not be showing them sympathy when you should be showing them empathy. For example, if somebody is telling you they're going through like financial crisis, shouldn't be saying that, oh, your own is good. Like some people cannot see food to eat or whatever. Like again, their feelings are valid and their problems are valid. So not using other people's problem to validate their own, it's one way so people can just shut down. So I think giving them that listening ear and make them feel like they are heard can really help them to again start feeling like, okay, I'm not going to be judged if I express how I feel. But I think,
What
yeah,
about
for
people who
me,
are closed-mouthed? We know that there are many men who would rather keep things to themselves than, talk to someone. How do you begin? Even women,
yeah,
I can do it all myself, especially if they are, maybe going through things that they don't want to talk. How do you, if you are maybe a part of this person's life and you are sensing that something is not right, something is awry, really, how do you
yeah,
approach such people? Because it's okay if they can talk. At least you know where to start. You know what, I mean, you can
yeah.
find the words. But what about those who don't talk, but you can sense there's something wrong in their demeanor?
I think it's giving him that safe space. I think once you can spot it and you can feel that they're acting different, it's just giving him that safe space. I think everybody want to talk, even me myself. I was in the same similar situation when I was going through grief, and I first of all the shame of speaking was the number one thing holding me back. But immediately I found that safe space to share, that I was not going to be judged. Then it just came easy. So I think, yeah, giving people the safe space to share and also just giving them resources. Sometimes they might not feel safe talking to you, but if you can give them resources like, oh, do you know that there's help here. Yeah, you can talk to this person. I think that can give them, at least you're not forcing them, but you're kind of guiding them to where they can seek help.
Yeah, we're in a traditional society, we're traditional people where, you know, despite our many degrees, we still have we have some cultural and social stigmas around suicide in
Yeah.
Africa. And there's also fears that if you discuss self-harm and issues like that, you are encouraging it. For instance, a teacher who is in a school where you have the young ones from 15 to 29, and that's the age that the WHO is really worried about. How does such a teacher, broach that conversation without, it being seen as encouraging it?
Yeah, I think if the teacher is well educated themselves, then because sometimes people cannot act as professionals. So when they start acting like professionals, I think that's where the issue will be. So if you're not a qualified therapist or psychologist or psychiatrist, then you need to be mindful of what sort of like advice that you're giving or guidance you're giving to somebody who is going through that help. So I think, yeah, people need to be mindful of how they sort of give people advice and yeah, make sure they're guiding people to the right support system, either from their family or their community or from actual like professional like in the hospital.
In at least 10 African countries, attempted suicide remains a crime. Again, perpetuating the stigmatization and preventing individuals from seeking or accessing adequate support. How, in your view, are we addressing this across the spectrum? Are we doing enough, or do you think there are gaps that needs to be filled in how we address this?
Yeah, I think that's totally wrong, because again, you cannot punish people for being ill. If somebody is mentally ill and they need support, and just criminalizing it is just, yeah, I just can't get my head around it. I do work with a solicitor in Pakistan who they had the same issue there, but they've been able to change the policy through their research, and I hope, yeah, we can do that as well because, again, yeah, people don't just wake up one morning and feel that way. People are ill, just the same. It's almost like somebody has malaria and you sending them to prison. Like, it doesn't make any sense. The same way we have physical illness, then somebody has mental illness, then they should be getting the support they need. Yeah, so we have work to do. Like that needs to be changed.
Well, due to the low investment in mental health services, the African region has one psychiatrist for every 500,000 inhabitants, which is 100
Yeah,
times less than the recommendation by WHO. Is there any
yeah,
work being done to address this, to your knowledge?
yeah. I think, sorry, I think as much as low as the services, I think before last year I thought that was the bigger problem, but the bigger problem is that people, even if there were enough professionals, people are not actually using the services the way they're using the physical services or hospitals. So I speak with a lot of therapists and psychologists who are not, yeah, they're not really getting bookings. And I'm like, really? Like, I would have thought they'll be kind of maxed out and people are waiting for like a month or two to speak to them, but they're actually free. So, yeah, that's a problem. But the bigger problem is majority of the people are not going to seek help. Majority of the people are not speaking.
I'm going to circle back to social media and the media this time. Can media reporting lead to more suicide? On the flip side, if that is the case, on the flip side, how can the media and social media platforms be leveraged to raise awareness about suicide prevention instead?
Yeah, I think it's with media, like the right information needs to be out there. And I think once people are receiving the right information and it's not glorified or in any way or inspiring anyone to feel like, okay, yeah, if that person can do it, I can as well. So I think that can really help to prevent it. But speaking about it and just again educating people through media is one of the best ways I think we can actually tackle this problem.
Okay. So, is there a role here for government? Because we seem we have every conversation and then we go back to saying, what can the government do? Are you satisfied with the efforts that governments are putting out, especially in schools and educational institutions, towards preventing suicide in Africa?
Yeah, I think the government has a massive role to play from the policies to support and providing the necessary funding in these departments of mental health in various hospitals. I think that would go a long way to provide better services and also better pay for mental health professionals as well, because we do need them to actually go into these roles. So if you look at the pay gap between mental health professionals and physical health, like doctors, is the gap is very wide. So I think that could be something the government could do to encourage more people to go into this space. Apart from that, policies ensuring that companies are prioritizing their employees' mental health, and that's something that is compulsory. It's their duty of care to ensure that these services are in place for employees. I think that would help as well, because a lot of people go through work stress, and that could be a cause of severe mental health issues. Yeah.
Okay, and Kelvin, I'm going to want you to reach in deep from your experience to answer this. From your background, your home, and all of that. Are there any unique or cultural, community-based interventions, traditional, conventional, that have been successful in preventing suicide in any part of Africa? And is it something we can replicate?
I'm not aware of, apart from our religious support system, I would say. I've been, definitely been able to help people to share and just have been in that community where you can be hopeful and avoid getting to that stage of their mental health. But apart from that, I'm not really sure. I can really, point anything apart from our religious.
Okay, talk to us about your experience with as being a mental health campaigner. Talk to us about your experience, the work that you do, and how you feel it can be better.
Yeah, I think for me, it was more of a case of I just didn't understand what it was. And when I was going through grief, I had to be in a very severe mental health like challenge before I could like, oh yeah, let me speak to somebody. But it shouldn't be like that. People should be able to spot when they're not feeling okay to seek help early. And I think that's what we're trying to do, to just give people that education on various societal problems that are linked to bad mental health, from unemployment to crime to relationship issues to work stress, productivity, addiction, and all these things are part of the bigger problem. So when people think about mental health challenges, they probably just think about depression or suicide, but it's everything that has to do with us. For us to become our best self, we have to be mentally okay. So those are like things that we're trying to educate people so that it's not like a one size fit all when like people hear mental health issues, they just feel like, no, it's not for me. I'm not feeling depressed. So what you're saying does not concern me, but it does concern everybody because we all have mental health the way we have physical health.
I'm still staying with you. You mentioned your struggles before you made the decision to speak to someone, and we know there are many men like yourself who don't
Yeah.
find it easy to open up. How did you arrive at the decision to seek help? Maybe your experience can help someone watching.
Yeah, again, as I said, I got to a point where I was kind of like in that level 9, level 10, where you're not just feeling happy within yourself. You know, when like you don't need anybody to convince you that, yeah, you need to speak to someone. So I think at that stage, it's not good because you can result to negative things. So people can go into drinking or drugs or harming themselves. So it's just, yeah, even with our services, we did notice we had a trend where people that come seek help, they're usually in that like level 9, level 10 crisis. So how can we prevent people not getting to that stage before they seek help? So I think that was for me. So what we're trying to do now is how we can help people not to get to that point.
All right, mental health at workplace, something you said. I want you to, expand on that. What should we be looking at as appropriate responses from employers to help in managing the mental health of staff and keeping them at optimal performance?
Yeah, I think it's more of just having that safe space at work because a lot of us spend a lot of our time at work, and work again can come with its own stress and challenges, meeting targets, performance. So that causes a lot of stress on people. Work security, job security as well, is another issue. So again, if employers can not just provide the services, but also give people the safe space to use the services. Because I've had people who have spoken to me and like, yeah, we have mental health support in my work, but I don't feel safe speaking to somebody at work because they might use it against me, they might see me as weak. So those sort of fear would, yeah, make a lot of people not even want to use the service. So creating that culture, training their employees regularly, proactive, not just ticking a box to say, oh yeah, we have mental health support uh, in our employee benefit program, but actually following up to ensure that the employees are using the service, or if they are not using the service, find out why and yeah, give them that support that they need because again, it does help even if you think you're okay, but you can still improve your mental health by just yeah speaking to somebody.
Okay, there's another part I want you to also speak on, and that is teenagers and academic pressure. I once
Yeah.
had a relative who attempted taking his own life because he felt pressured and he felt he was not, at par with his peers. If you were to
Yeah.
speak to teenagers now on the pressure to succeed, to excel, to be the best in their class, what would you say to them, and what would you say to their parents as to so they can take the pressure and prevent suicide from happening?
Yeah, I think it's again just giving him that reassurance and stop the comparison. Yeah, I think that is one of the things that put a lot of pressure on young people, and just yeah, social media as well. When they see other people their age, again maybe yeah, being successful, that could be another reason. I think yeah, giving children love, yeah, and that safe space for them to be themselves, because we're all different and we are all on different journeys. So yeah, that can really help them to again just
All
know
right, to
that they
wrap
don't
up,
have to be like
I
somebody else.
guess we're talking about hypothetical people and young people and generic persons that might be impacted. But there's someone who is watching us now that might need to hear something to stay on this side of the universe. What message
Yeah.
would you like to convey to our viewer who may be struggling with suicidal thoughts or knows someone who is?
Yeah, I think it's just to remember their why and to remember like there are people that care and to reach out to them and think about what it would do to them, like how it will affect them. Because again, we have to think about our loved ones and just know that people care. Because sometimes we might think, oh, nobody cares, and yeah, I'm just on my own, and yeah, but there are people that actually care from your family, your friends, community. Yeah, just reach out and just seek help. Yeah, speak to somebody.
All right, Kelvin, thank you for speaking with us. We appreciate your time.
Thank you so much. Thank you for having me.